Good afternoon, everyone. We are live today at Sakra World Hospital, Bangalore. We have with us Dr. Vijay Kumar, who is an associate consultant gastroenterology and hepatology. He is a part of the Institute of Digestive and Hepatobiliary Sciences at Sakra World Hospital. Welcome, Dr. Vijay Kumar.
Thank you, Dipti. Good afternoon, viewers. Gastroenterology and hepatology is a subdivision of medicine which deals with our digestive system or alimentary tract. We here in Sakra World Hospital have full-fledged gastroenterology department. So other than the routine diagnostic procedures and OPD and inpatient care, we have some of the advanced endoscopic procedures like endoscopic ultrasound, US guided therapeutic procedures, advanced methods to relieve polyps from the intestinal tracts, and as well as bariatric endoscopy.
Nice. Okay. So we will be discussing all the details related to understanding gastrointestinal disorders and ways to manage it. Thank you so much for the insight. Doctor, here are a few questions from our viewers. What are gastrointestinal disorders?
So gastrointestinal disorders are we have a wide spectrum of diseases. So it may the diseases may affect any part of our digestive system, starting from mouth, esophagus, stomach, intestine till anus. It also includes some of the other solid organs like diseases of liver, diseases of spleen, and as well as pancreas. So together, the whole spectra is covered under gastrointestinal.
Okay, so almost everything.
Everything.
Okay. So what are the most common signs and symptoms of gastrointestinal disorders?
So when it comes to most common signs and symptoms, it depends on the area of the GI tract which gets affected the most.
Okay.
For example, somebody is having a disorder of esophagus or the food pipe. They usually present with like difficulty in swallowing, which we call it as dysphagia. Some present with painful swallowing, we call it as odynophagia.
Okay.
So when it comes to disorders of GE junction, where the food pipe and the stomach are connected, this is one of the common entity we routinely see in our practice, where people come with reflux symptoms.
Okay.
So refluxing.
Something called the GERD or something.
Yes, that is known as GERD in medical terms. In common people words, it is reflux symptoms, which tend to bother them most. Some of the disorders which affect stomach, commonly the peptic ulcer disease, what we call it. In other words, it is gastric ulcers and duodenal ulcers.
Okay.
People tend to have long-standing pain abdomen, more often in the upper part of their upper abdomen, which has some relation with the food intake. So this is often seen in stomach. When it comes to intestine and colon, commonly we see those patients who had some of the intestinal infection, what we call it as gastroenteritis. So they may have loose stools, they may have blood in stools. So these are all the different symptoms and signs. Signs are something which we see when we examine them. Symptoms are those which usually patient complain to us. So it depends on the part of GI tract that is affected. When it comes to liver, usually patient presents with some right upper quadrant pain, which is a feature of gallstone or biliary disease. Importantly, it is jaundice. So jaundice is again a very important clinical symptom and sign of liver disease.
Okay. What causes gastrointestinal disorder?
When it comes to cause or etiology of gastrointestinal disorders, it's vague and we have plenty of things which affect our GI tract. Starting from the food we eat, even a small variation in the food we eat, it may affect our digestive system. That's often seen in daily practice. Other than that, etiology includes infective causes. People have infection, they present with gastroenteritis. People, when they have infection of liver, what we call it as hepatitis. Hepatitis depends on the viral, different viruses. So they present with jaundice. So most often it is either change in the food intake or infection, which commonly come to our department. So some of the rare causes where people present with GI disorders include ulcers, malignancies. You were about to ask regarding elderly people. Somebody who is 60 plus, 70 plus, yes, they may have malignancy, which is very rare in youngsters.
And having spicy food, does that affect, does that create these ulcers? There's some elders at home keep telling us.
This is very, I can say, the common belief where people say, sir, I ate a lot of spicy food, I'm having ulcers, I keep eating tomatoes, I have ulcers, I keep eating this, that. But when it comes to scientific basis and evidence, there are certain category of foods which will precipitate or aggravate the already present symptoms. Patient has some reflex symptoms, but when he consumes this particular foods, for some it is tomatoes, for some it is some oranges or citrus fruits, for some it is high spicy foods, for some it is oily food. These things will aggravate the symptoms. So rather than the main etiology, it is the aggravating. These things will aggravate the already present symptoms.
And some people even tell us that there's a common myth that if somebody is smelling bad from their mouth, other than your dental hygiene, they say if there's something wrong with your digestive system,
yes.
You get that kind of a stink.
Yes.
Is that true, or is it a...
In medical terms, we call it as halitosis. Halitosis is something known as bad breath. A lot of most common cause for halitosis is something which is in the oral cavity. If they have tooth caries, if they don't have a good oral hygiene, they tend to have bad breath. But sometimes when people tend to present with dyspepsia, like they have excessive bloat, excessive gas, food not getting good digestion, even they present with recurrent burps and as well as bad breath. Yes, bad breath is also one of the symptoms we often see in our OPDs.
How do you treat the gastrointestinal disorders?
So treatment, most of the gastrointestinal disorders, which we day to day see, require very short course of treatment. We usually treat them for, let us say, 3 days, 5 days, with usually symptomatic medications will be given, unless somebody presents with very major issues, where we need to admit them, keep them as inpatient and treat them in the ward. For some of the therapeutic interventions are required, which we regularly do in our department. Suppose if we suspect a gastric ulcer, we need to do endoscopy. We need to do endoscopy for a gastric ulcer, duodenal ulcer, look at the type of ulcer. If it is not a good looking ulcer, sometimes we might have to take biopsies. We check whether somebody is infected with H. pylori, which is common cause of the gastric and duodenal ulcers. So we need to check for that, treat H. pylori. These are some of the therapeutic procedures which we do. Suppose somebody presents with a GI bleed. It has various causes of GI bleed, often seen in alcoholics and cirrhotic patients at their end stage, where they present with a lot of GI bleed, and as well as the common ulcers, peptic ulcer disease, even they present with GI bleed. So these are handled through endoscopic methods. We do endoscopy, we may inject something to prevent bleed, we may band the varices in case of cirrhotic patients, or we may have to do some clipping to prevent bleed. So some are therapeutic procedures which are done through endoscopy. Some through admission to ward, giving IV fluids, medications, antibiotics, etc. Most of them through OPD basis.
Depends on the complexity.
Yes, it depends.
What are the home remedies for gastrointestinal disorders?
Yes, home remedies as this is one fancy topic which people keep asking the moment they come to OPD. Sir, can I take this? Can I take a lot of indigestion? My mom gave this, my grandma gave this. So when it comes to scientific evidence, we have some of the papers where they have done population-based studies and some observation where there is support for only few home remedies. For example, ginger. Ginger, where even scientifically it is proven that it acts on many receptors on our upper GI tract, aids digestion. Ginger promotes motility. Somebody who is having motility problem, they often take, sir, can I take ginger? Ginger keeps me well. Yes, ginger promotes motility. When they have nausea, the nausea is nothing but tendency to feel pukish or tendency to vomit, which is often seen in pregnants. They keep telling, can I take ginger? Yes, I will be fine. Yes. Ginger reduces nausea. Ginger promotes the GI motility or gastrointestinal motility. Then another scientifically proven home remedy is turmeric. Now, most of the pharma companies have extracted the turmeric active content and it's available in capsule.
It's called some curcumin.
Yes, curcumin is an active ingredient which they have made it in a capsule. But we Indians, we are using since thousands of years. Whatever dish we make,
Absolutely.
starting from small sabji, sambar or whatever it is, we keep adding turmeric, which is very helpful for our gut. Turmeric is a proven entity which improves if there are some ulcers, if there are some erosions, the gut motility, particularly the gut integrity between each cells. It's very much proven that turmeric helps it.
Okay.
So turmeric is always protective and it is anti-carcinogenic. It prevents formation of cancer. That's why you may see the Indian population and as well as Westerners, we tend to have less amount of colon cancer and other intestinal related cancer when compared to Americans. Colon cancer is very high in them, but relatively less in them. Maybe turmeric may be playing some role. Anyway, we have those things. Another entity is people keep taking senna and as well as husk. It is very commonly used for constipation. People keep using it. Other than some of the bloating, we don't have any much side effect with senna and husk. And people use methi, fenugreek.
Yes.
That's also very important thing. Diabetics keep taking that, and it aids bowel movement, and it's good for constipation. But we should be very cautious while using home remedies. Some of these entities, particularly ginger or even methi, they have some interactions, particularly with the blood clotting disease. Somebody is on blood thinners, yes, they have to be very careful while trying these home remedies. Instead of home remedies, I would suggest you better include them in your daily routine diet so that you remain healthy.
What is the difference between anal fissure and hemorrhoids?
Yes. Anal fissure and hemorrhoids, both of them are, I can say, usually the common lower GI symptoms which we often see. Hemorrhoids are nothing but dilated veins or blood vessels in the lower part of our GI. Anal canal, where somebody excretes, in that area, if the veins are dilated, we call it as hemorrhoids in simple words. Hemorrhoids, normally everybody has veins. Hemorrhoids are normal columns, they don't affect anybody. But when they're enlarged, when they bleed, then it becomes problematic. It is often seen in patients with chronic constipation. Whereas fissure or anal fissure is nothing but a break in the anal region. You can say tear, in simple words, it's a small tear in the anal region. What is the difference between them? Because patients, sir, I may have hemorrhoids, I may have fissure, what do I have? Both of them, they may present with bleed. But bleed in hemorrhoid is something painless. Usually it is painless, they don't have pain. What patients tell, sir, I passed my stools, it was very hard, I need to strain a lot, and at the end of stools, I noticed few drops of blood. It was painless. They'll have such recurrent bleeds going on for years together. That is how hemorrhoids present. Whereas fissure, which is also seen in a chronic constipated individual, is very, very, very painful. They do not tolerate pain. They immediately rush to a doctor. Doctor, do something.
Okay. So that's the difference.
Yeah, that's the difference. Both may have bleed, but it's a painful entity in anal fissure. It's majority painless in case of hemorrhoids.
Okay. What causes food not to digest?
Yeah, this is something blanket term which everybody uses. Indigestion. Sir, my food is not getting digested. I see the same particles, everything. Usually, indigestion is often seen when somebody have gastroenteritis or some infection. They eat outside food, a lot of infection. They may have this indigestion symptom. It's a vague blanket term used. They may have bloating. They may not have that appetite. So they'll have loose stools. They say, no, digest nahi. No, I'm not getting digested. It's a vague term actually.
Okay.
So there are various causes for indigestion. So most of it is usually due to infections and change in the food habits.
Overeating.
Partly, yes. Yes,
Okay.
yes.
What causes food poisoning?
Yeah, this is one common entity which we see, food poisoning. You keep seeing in the news and even people say, like there's a bunch of people who fell ill. What happened? It's food poisoning. So food poisoning is something where we ingest either toxins or infectious agents. Let us say in some cases, for example, fried rice. It's already infected and toxin is already found in the fried rice. Despite serving it to the people with all this heated this thing, frying it, still toxin is persisting. So this is preformed toxin, already formed bad toxins, poison within the food. When we eat that, so immediately somebody may have this, crampy pain in the abdomen, and they tend to have loose stools, several episodes of vomiting. Yes, this is food poisoning. Second entity, you eat in a roadside or anywhere which is unhealthy, unhygienic food, and you land up in these things. Even that is food poisoning. It need not be that there is somebody who is mixing poison into the food. No. Any infected, any gastroenteritis, yes, it may be food poisoning.
Even if you're allergic to something in the food.
So that's a different entity. We don't call that as a food poisoning.
Okay.
No, because it's different. Suppose, let us say, I keep regularly eating seafood. Somewhere I go outside and some uncooked, unhygienic seafood I take. I have this loose stools, vomiting. That becomes food poisoning. And second entity where I haven't never tried seafood. I go to a hotel and I take food and I have some rashes, everything, the swelling of my lips, everything. That is allergy. So allergy and food poisoning are entirely different entities.
Okay. What are probiotics and how are they helpful?
Yes, probiotics is something which you often see in a lot of televisions, all social medias. You go to a medical shop, you see this probiotic is very good for health, very good for even vegetable vendors in a big vegetable shop. Go to any mall, you have a bunch of probiotics which is being sold.
They're sold in these small bottles.
Yes, small bottles over the counter. What are probiotics? Probiotics are nothing but good bacteria. So all of us in our gut is full of bacteria. We should know. Starting from the stomach to the colon and the rectum, it is started with bacteria. Similarly, we are blessed with good bacteria and as well as bad bacteria. Normally, we have very high, in a healthy individual, the amount of good bacteria or the ratio of good bacteria is very high. So that these bad people are always suppressed. There are some conditions, it may be a small gastroenteritis or a liver disease, cirrhosis, or you may be taking a lot of antibiotics. Nowadays, people get headache, go take antibiotic, sneezing, go take antibiotic, one day episode of fever, go take antibiotics. All these entities will destroy the amount of good bacteria which is present in the gut. So when these good people come down, obviously it's the time for all these bad people to grow. So there will be increase in the bad bacteria ratio, so which results in a lot of this indigestion, gas, bloating, loose stools, everything. So these good bacteria, if they are supplemented from outside food, we call them as probiotic. Common probiotic which we day to day use is something curd. Okay, and most of the probiotic preparations like yogurt, you may see that is a processed curd with added amount of fortified with good bacteria. So most often they use lactobacillus and bifidobacterium species, which will promote the gut health. So in general, what I mean to say, please use more curds.
Okay.
That is the best. You can't keep taking this probiotic drink. No, better use curds. Curds are very good for health. They have rich this probiotics or good bacteria, which will keep our gut integrity intact. They prevent you all these infections. Even let us say some bad bacteria come from the outside or into our GI tract through food or something. These good bacteria will fight them and knock them off.
Nice. What causes constipation?
Yes, constipation is something which is often not discussed in a group, but we see majority of them like they are done with their life. So it is it appears very simple. Constipation is simple, nothing, not passing stools. But you can see there's a lot of patients who suffer from this constipation. A lot of issues with their personal life, the way they behave, everything. So constipation is something which affects our personal life. It is not just gut. When compared to Westerners, we Indians tend to pass, most of them pass 1 to 2 stools in a day. Whereas in the Western population, it may be different. They may pass, let us say, thrice in a week or 4 times in a week. So in that way, Indians, we are all blessed. We have good amount of fiber content. We take a lot of water, everything, so that our bowel movement is regular. So when this is not there, we call it as constipation. Constipation is something where you have difficulty in passing stools. Some people may be passing even one stool a day, but they may take a lot of time. They keep spending 20 minutes, 30 minutes, 40 minutes in toilet, sitting, straining, and they pass very hard pelletary stools. Even that is constipation. So common causes for constipation, it may like vary with age or anything. Generally, somebody who is not consuming enough fiber in their diet, enough fluid in their diet, they tend to have constipation.
Okay.
Otherwise, suppose let us say elderly people, somebody who is 60 plus, 70 plus, the whole colonic movement is reduced. So they tend to have constipation. Whereas some people on drugs, very commonly they take some painkillers like tramadol, everything, they tend to have constipation. People with hypothyroidism, it's very common. We're seeing a lot of young people, women who have hypothyroidism, not well controlled, they suffer from constipation. Drugs, particularly contraceptive pills, estrogens and progesterones, people tend to have constipation with those drugs. And if they have the pelvic anatomy, if there is some problem, they have very high sphincter pressure. Sphincters are nothing but a gateway where the stool passes from the rectum through the anal canal outside. If there is any problem in that gateway, they have high pressure, still they tend to have constipation. Okay. So this is the spectra.
What is the role of yoga or exercise in managing gastrointestinal disorder?
Yes. When it comes to exercises, I would say aerobic exercises play a very important role in maintaining your gut health. As we know that this is the era of obesity. Obesity has become pandemic. It is throughout the world. So this obesity leading to a lot of GI disorders, starting from reflux, GERD, obesity triggers gastrointestinal reflux disease. Obesity leads to fatty liver. You see, now and then people come with their ultrasound report.
Yes.
Sir, grade 1 fatty liver, grade 2, grade 3 fatty liver. Obesity is something which causes fatty liver again. Obesity is a morbid disease. Obesity also causes cancer. So this is why the obesity is like pandemic throughout the world. When it comes to yoga, exercise, I would prefer people should at least do 30 to 40 minutes of aerobic exercises in a day. 30 to 40 minutes. At least 4 to 5 days in a week. It may be like just a brisk walk, it may be jogging, some may prefer to swim, play badminton, whatever it is, do aerobic exercises. That increases or stabilizes your gut motility. Yoga we have nowadays because in the recent 3-4 years there is surge in the awareness, particularly people are doing yoga everywhere. So yoga, other than just letting down your weight, it is something mental health which is well balanced with yoga, which is always very important. For constipation also we have different asanas. I think some of the yoga teachers keep telling that this is good for constipation, this is good for this. Particularly for constipation we have a lot of specific yoga postures which may help people to overcome their problems.
Nice.
So definitely
because this is one of the most common questions which come up.
And particularly when you take up NAFLD or NASH or fatty liver, the first step therapy for fatty liver is exercises. Aerobic exercises will cut down the fat and brings, it reverses fatty liver actually.
What is the long-term impact of indigestion?
This is very commonly seen in our department, in our specialty, because some people tend to keep neglecting things. Okay, I'm having little gas, little this thing which is there for years together. Some may have loose stools years together. So it may be part of normal spectra also. For example, some people may pass 2 to 3 stools in a day. You may find it somewhat weird because everybody passes 1 to 2, but they may have, maybe due to irritable bowel, which is not an alarming symptom. Some people may have some bloating, like the feeling of fullness after eating something. Mild reflux symptoms. It is not much bothering type. But if these symptoms are associated with some of the red flag signs, what we call in a medical term red flag signs, somebody is losing weight, significant weight loss, unexpected weight loss. If you're on a diet, you're regularly exercising, you lose weight, that's fine. But you're not on anything, you're losing weight, yes, that's an alarming sign. Weight loss is an alarming sign. Blood in stools. either through vomiting or while passing stools. Blood in stools is again a red flag or a warning sign.
Okay.
Then recurrent episode of vomiting, unexplained sudden pain abdomen. Usually they'll have some spasmodic pain which they keep taking over-the-counter medications. But then there's sudden unexplainable pain abdomen which leads to vomiting, everything. It's again a red flag sign. Presence of jaundice. People keep taking all those medications, liver cup problem. But sometimes you present with jaundice. Yes, these are all warning signs, or I would like to call red flag signs, which people should consult their doctor. Should consult their primary care physician or any doctor, so that this warning sign should never be neglected, because they may have underlying actual disease, or it may be masking some malignancy. That's why we should not neglect all these things.
It was a very informative session. Thank you so much.
Thank you,
Vijay Kumar.
thank you, Dipti, and I thank all the viewers through Facebook, Sakra, and I think any queries will be ready to take.
Yes. With this, we wrap up today's session. If you have any queries, you can leave it in the comment section. Our experts will revert back to you on the same. Thank you.